Greetings. Welcome to In Conversation with Trevor, brought to you by Heart and Soul Broadcasting Services. I go beyond the headlines and beyond the sensational. Today, I'm in conversation with Mudiwa Ashley Mundawarara, the Executive Director of Island Hospice and Healthcare. If you enjoy this conversation, remember to subscribe, to like, and to share. Let's get down to some work. Mudiwa Ashley Mundawarara, welcome to In Conversation with Trevor.
Thank you, Trevor.
Great to have you here to help us understand, Mudiwa, what Island Hospice is all about. But first of all, Ashley, what's the meaning of Ashley?
Well, apparently when my parents named me, they named me Mudiwa, obviously. And then I think my mother, she can't remember whom exactly it was, but they met somebody with the name Ashley and they really liked the name. So they gave
it to
me
you.
that name. That's right. So I'm named after some stranger that we can't remember. Right.
The names we carry and the meanings of our names are fascinating. Mudiwa, you have done a pivot with your career. And I just want to find out why. You were 2007, 2015, the CEO of Medscheme, Zimbabwe. And then 2001, 2003, going in reverse, you were the CEO of Kebs Holdings Limited. And now you are the Executive Director of Island Hospice and Healthcare. Why the pivot?
Well, I must admit that it was a very good friend and older brother of mine, Patrick Chingoka, who approached me and said he was deputy chairman of the board and chairman of the HR committee of Island. And the board, the executive director then was leaving. They wanted somebody to come in with some business background because there was need for us as Island to start looking at ways of generating revenue because of flagging sort of contributions and donations. Island has historically depended on donations. And the board felt that there was need for Island to take a little bit more charge of its revenue streams. So they wanted somebody with a business background.
But why did you take the job? What motivated you to agree to what Patrick was suggesting?
Well, first of all, Patrick is very persuasive.
Yeah.
And secondly, I think it had to do with at the time I was also engaged in, I was a minister of an extraordinary minister of the Eucharist at church. And it was something that really touched me. And I think the work sort of seemed very similar. And I think that since then has proven to be just almost a life-changing experience.
Talk to me about the work that touched you. Do you want to unpack that, the work that touched you?
Well, Island Hospice deals with people who are suffering from chronic illnesses. Sometimes it's people who are dying, although it's not only about end-of-life care. And the people that are there are amazing, tremendously talented, dedicated individuals. And I've just seen them, in the field. I've seen how they work, and it has really touched me. I feel very privileged to actually be associated with and as part of such an inspiring organization.
And correct me if I'm wrong, Island Hospice established in 1979 and perhaps one of the first in Africa, am I right?
In fact, Island Hospice was the first hospice in Africa. Quite a few have come up since then. But yes, we'll be 45 years old this year. And that's quite a long time. And if you travel throughout the continent and you talk to anybody in palliative care, you'll find that at one time they were either trained by, worked at, or in some way sort of associated with or mentored by Island. So Island has quite a quite a strong reputation throughout the continent.
What does Island Hospice do? Do you want to just unpack the work that these wonderful people that you're talking about do on a day-to-day basis?
I think in summary, we work in palliative care. Now, what is palliative care? Palliative care recognizes that the patient has more than just physical needs. They have social needs, they have emotional needs, they have spiritual needs. So because of that, when somebody's suffering from a chronic illness, it doesn't just affect them, it affects the social structure that they're in, be it family or whatever. As a result, we get involved not just in treating we don't even do the treatment. It's usually a doctor refers a patient to us. He is the primary caregiver. We provide supportive care. In fact, I think perhaps maybe what I should do is, what's more descriptive is supportive care.
Okay.
We work with doctors, we work with nurses, we work with social workers. We can even work with physiotherapists and various other people. We counsel the patient to deal with their illness. We counsel the patient's family. We work with their religious leaders, whatever religion they might be. We don't discriminate, be they Christian, be they Jewish, be they Muslim. And so we provide that supportive care. And in the case of people who are on that last final journey, we walk through with them right through to that, and including bereavement care afterwards, bereavement counseling for the families thereafter.
And what's the footprint, the geographic footprint in Zimbabwe of Island Hospice and Healthcare?
Well, we operate from 4 different branches.
Right.
We have our headquarters in Harare. We operate in Bulawayo, in Mutare, and Marondera. We'd like to be everywhere. We'd like to be in Midlands. We'd like to be in Masvingo, maybe even in Mash West. But resource constraints are such that we have to work with where we are right now.
Resource constraints. I get the sense that with the war in Ukraine, with the war Hamas and Israel, donor funding is constrained. Are you feeling that pain?
Indeed. A number of different countries have are more inward looking. And so they've tended to divert aid, as you said, to things such as Ukraine, but also, shrinking sort of foreign aid has affected us quite considerably. We are looking to try and expand beyond the traditional countries from which we've been funded, the United Kingdom. We're looking now towards the Middle East. We're looking towards the Far East. And we want to look more towards even Africa, high net worth individuals, foundations within Africa. But I think allied to that, as I mentioned earlier on, is the fact that what we need to do is up our social enterprise activities. Those businesses that we engage in to generate revenue for the organization. We operate a nursing agency. We hire out nursing agencies. And it's actually a good sort of adjunct to what we do, because our nurse aides are trained in palliative care. So they are very good for taking care of either chronically ill patients or the elderly. We hire out medical equipment. Acquiring that equipment is difficult. We're a non-profit organization, but so we rely a lot on donations. Interestingly enough, a lot of the equipment that we hire out comes from people whom we've served. We recently had a family where the father passed away. They had invested in hospital beds and all kinds of equipment, including oxygen concentrator and everything. And, they donated it to Island, because, in gratitude for what we do. So this is what helps to sustain us, one, and two, both materially and even morally. I think it's very good for our people when people come back and show gratitude. We employ 38 people throughout the country.
Okay.
However, we have a volunteer force of close to 300. And when you talk to the volunteers, you'll find that so many of them are people who will say, you cared for my father, you cared for my grandfather, you cared for whatever, and I want to channel it back. So those are the sort of things that I think we need to get that message out there to people, that we need your donations, not just materially, but even in terms of time. People who really feel that they would like to give up their time to come and help people who are suffering from chronic illnesses, etc. By all means, contact us. We will train you properly. We only put out properly and fully trained people. We have volunteer caregivers who do counseling, but they have to go through 12 modules. And then even after that, they're still vetted. We still vet them to see if they are suitable for that kind of work.
So somebody's going to be watching now, as they do, and there's a lot of other people appealing for support. Why Island Hospice? Why should I turn my attention to Island Hospice? What would be your message to them?
Well, I know, first of all, the one thing people are concerned about is the money going to go where it should go? Governance is very strong with us. We have been in existence for 45 years. We have had 44 annual general meetings at which we do table audited accounts. Our accounts are audited. This is a requirement not just from our board, but even for the international donors. They usually want that. So you know that if you do contribute to Island, you do know that the funds will be handled properly. Secondly, as I said, this is a service that I think a lot of people don't really appreciate until they need it. When you're healthy, it's fine. But when you're not healthy, and as I said, you get diagnosed with a chronic illness like cancer, it creates all kinds of problems. You know, the many misconceptions and the many and how and how what people associate with those diseases. And we help you. We'll help you. We'll counsel you. We'll counsel your family. You know, kids, I think, they need special attention when a parent is diagnosed with a chronic illness. And these are the sort of things that we help people with.
You know, as you're talking, Mudiwa, you're taking me to our own personal circumstances. Me and my wife, our mother-in-law was diagnosed with Alzheimer's, and you know, it's not something that you familiar with, and suddenly you are landed with this condition that you don't understand. So I can understand and appreciate the importance of somebody talking to us about what Alzheimer's is all about. We've had to get 24/7 nursing care for my mother-in-law. It was tough. It was painful. It was traumatic to us, to my wife in particular. Just watching mom deteriorate the way she was until she started reaching out for support organizations within that space. Do you identify with that at all?
Absolutely, Trevor. That's precisely what we do. And as I said, we work with social workers, clinical social workers, nurses. We advise not just the patient, but we even advise the practitioners.
Right.
We have some of our nurses and doctors are experts in pain management. They can teach most medical professionals about that. And even when it comes now to sensitizing doctors and nurses and other healthcare professionals to the needs of people who suffer from chronic illnesses, that's what we do. We attended a meeting of the surgeons last year, a colleague of mine. And we ended up having to remind the surgeons, for example, that surgery is traumatic for people. It's trauma. And it's something that they gave them pause for thought to say, oh, well, yes, sometimes we just come in and it's...
Because they do it every day.
It's a heart, it's a whatever, and we forget that there's a patient that's attached to that, and that handling that patient in a certain way can even aid outcome, to come to better outcomes.
Mudiwa, we're going to take a break. When you come back, don't go away at home. We're going to drill into Island Hospice is 1,000 patients and clients, But perhaps much more importantly, is this an area where medical aid should be coming in? What can be done to bring in medical aids into the space? So see you on the other side.
We cannot provide a service for free anymore. We used to, and in fact, we didn't do it for free. We used to have a lot of donors who were able to support.
Welcome back to our conversation with Mudiwa Ashley Mundawarara, Executive Director of Island Hospice and Healthcare. Mudiwa, people watching there are going to say, Mudiwa, you got to be realistic because times are changing. And I think you've hinted, donor funding is not going to be there. What are you aggressively doing to ensure that Island Hospice is self-sustaining financially going forward? What projects should you be looking at with a much more keener eye?
Well, Trevor, as you mentioned, there's the social enterprise side of our business, the nurse agency. It's something that we do well, and we believe that our nurse aides are better trained than a lot of other nurse aides out there. We need to expand that service. We need to look at other ancillary services to that. One of the things that chronic patients need is they need to have messaging services. They need to have people help them with paying their bills and all of that sort of thing. But more than that, Trevor, what we really need to do also on the equipment side is to expand the range of products that we do. A lot of sort of higher tech equipment that people need. We'd like to be able to source that. We need to generate the funds to sort that, or to have people who would be willing to help us to donate that.
What kind of equipment? Are you in a position to name this equipment that you're looking for? Well,
as I said, things such as oxygen concentrators, a lot of the things that are to do with chronic care, digital, bedding. If you look out there at the moment, there's a lot of equipment that is there to aid people lifting, chair lifts and, helping people to get up, to enhance people's mobility, etc. So those are the sort of things that we want to look at: diagnostic equipment, etc. But other areas that we really need to expand into, and we need to look at a specialist pharmacy, for example, that specializes specifically in drugs for palliative care. And then that pharmacy can also be an adjunct for our equipment hire and everything. So you come to
how far are you with that project? It sounds like
we've identified where within our building we want to put it, but the seed capital, the startup capital is what we're lacking. We have approached one prominent foundation. We are hoping that will come to fruition. And then various corporates are always ready and willing to donate money to support supply of drugs for cancer and things like that. So we'd want some of those corporates, hopefully, to help support that undertaking. There are various other services that we would like to look at.
Is there a window of opportunity for collaboration with corporates regarding certain services that you provide that could give you a income resource of some sort?
Indeed, and specifically, I think we would want to look at the healthcare funding sector, at medical aids, to work with them. One, in terms of delivery of medical services, but two, also to fold into their benefits palliative care. We've seen studies that have been done in other countries that demonstrate that the earlier people seek palliative care, supportive care, the more savings that they can be. So that's where we think that there's a natural sort of relationship between us and medical aids in that regard, one. But even before we get there, research. we'd like them to, to help us to do research, even into looking into that, just the cost effectiveness of palliative care.
I gather that there's been a medical aid society that has taken on board PC patients with good success. Is that a practice that you think, let's integrate PC within the entire healthcare system? Should we not be doing that instead?
Absolutely. Yeah. Palliative care is cross-cutting. It deals with people suffering from chronic illnesses, be it communicable diseases such as HIV/AIDS, non-communicable diseases, cancer, road traffic accidents, victims of violent crime. All of these are people who require palliative care. And this is something that we're working with the Ministry of Health on. Island is actually the lead partner in a project that's funded by True Colours Trust in the United Kingdom. It's been going on for about 5 years now, and we're integrating palliative care into the healthcare system. We train doctors, nurses, and healthcare workers, right down to community health workers in palliative care. It's something that we need to take even to the private sector. I think it's something that even the business sector needs to look at.
I'm as you're talking, I'm thinking, who is carrying the burden of palliative care right now? It's the families. It's mothers who are at home. Society at large, apart from what you're doing, is sort of hands off. Surely we ought to get a point where I'm drawn to this book, what we owe each other as a society. Because at some point, you and I are going to get to that point, to that space. What role should central government, what role should medical aid societies be doing to ensure that society does pick a bit of the burden of taking care of palliative patients?
Well, for a start, it's getting to know and understand a lot more about what it is.
Yeah.
And as you said, it's supportive care. It's understanding that when a person is ill, they derive benefit from, not just from the doctors, but even from those people around them who can help them. It comes from understanding the importance of early detection. And that comes from knowledge and understanding these things. Cancer, for example, is not necessarily a death sentence. It just needs to be caught early enough. And if it's caught early enough, it can be treated. And many of the people that seek palliative care are not necessarily people who are dying. And they're people who live for a long time, cognizant of the measures that they should take to live with
and
their
it's one of those things, Mudiwa, that, like you said, you're not aware of how burdensome it is until it hits you. And when it does, you are not ready and you don't know where to turn to. So where do people get you?
Where
they find you? Yeah.
Find us on social media. But otherwise in Harare, they can find us in Belgravia. We're at number 6 Natal Road. Okay. And I'm sure we can put up on your thing
absolutely.
Our various
we'll
addresses.
Do that. Yes.
Why don't we do that in Bulawayo and in Maronda and in Mutare? But people coming to seek us, that's something I want to touch on, Trevor. One very, very, very big misconception about Island is that we only deal with people who are dying. So people are scared. When you say Island, they say, oh, no.
Misconceptions.
Absolutely.
Yeah.
I said palliative care begins from the point of diagnosis. And it's not just about end-of-life care. Certainly, end-of-life care is a component of palliative care. But from the day that your doctor tells you that you have cancer, the day that your doctor tells you have diabetes, you really need to seek palliative care that'll help you deal better with that illness. That is what we do. That's when you should come and see us.
The misconception is big, because until you reached out and until I started reading about President Jimmy Carter and the fact that he was going into hospice. My sense was this is about cancer patients. So you need to have a very robust communication strategy that helps people like myself understand that, Island Hospice and Healthcare does amazing work. So do you concede to that?
Absolutely, Trevor. We need to. It takes resources, not just that, but even human resources.
Yeah.
We in the medical field may be very good nurses, very good doctors. We're not always very good communicators. One of the big problems that I suffer with our nurses and our social workers and even our doctors that we work with is their reluctance to ask people for money. We cannot provide a service for free anymore. We used to, and in fact, we didn't do it for free. We used to have a lot of donors who were able to support. And unfortunately, as that support has fallen away, we've had to now seek payment directly from patients and clients. And sometimes even our people are reluctant to do that. Government doesn't even provide services free anymore. Nobody can afford free Nobody service. Can afford to. So we have to. But what we want especially is for those people who have the means to pay and even pay over and above the very modest fees that we ask, to recognize the fact that there is a large population out there that cannot pay. The pressures that the public health sector have come onto have resulted in a lot of people coming to us for help, when in actual fact, we should be referring them to the public sector. And our approach is we don't turn people away. So as a result, we've been inundated quite a lot with people who genuinely cannot afford to pay. But we do need to now become a little bit more assertive in charging people. We've introduced and we're introducing means testing so that we can ensure that when people say they cannot pay, we have to be able to ensure that is the case, that they cannot pay.
Mudiwa, within the bigger picture of the stresses that the nation is facing, what you're doing is important, but it is a drop in the ocean. Am I right?
Well, Trevor, the fact of the matter is that we as an organization do not have the wherewithal to be able to meet the palliative care needs of the country. That is why, as I said, we're involved in training government, and Ministry of Health is charged in particular. So there's obviously the wider thing about how well resources are there. Because we can't do it all. But we really do need to have people recognize that this is something that we need to lobby for. One of our functions is also advocacy, to always advocate for support for palliative care, which we believe is very important.
So at the moment, you don't get a grant from the government or anything?
No, we don't. Trevor, Island Hospice was one of 6 organizations in low to middle income countries throughout the world that was recognized by WHO as being a demonstration site. And they commissioned a study just to evaluate these 6 organizations, of which Island is one. And the other organizations were in South America, in Asia, and other sort of global South countries. And of those 6, Island was actually the only one that doesn't receive any government funding whatsoever. We met with the Minister of Health just last week, and we did take this up with him. But of course, the minister, it's not like the minister has spare cash. But I believe that an organization such as NASA, I think, is should, and in fact, I did have occasion to meet with the chairman of NASA socially, and I don't mind even publicly saying I want to hold him to the fact that he said, "Come and see us," and we will be going back to see him about that.
And so it's the conversations with central government. The conversations with NASA. I hope you succeed with people like Dr. Shava there, and the conversation with medical aid societies. something needs to be done. That's what you're saying, essentially.
Indeed.
Mudiwa, we're going to take a break here again. And when we get back, please don't go away. I want us to go to the work that you're doing in partnership with the King's College of London. Okay. Looking forward to that. So see you on the other side.
We are engaged in a research project to look into cancer, which involves 3 countries.
Greetings. My name is Trevor Ncube, host of In Conversation with Trevor, Zimbabwe's most engaging conversational show. I go beyond the headlines and beyond the sensational. We've brought before your screens change makers from arts, business, and politics, and from the region. Please join our growing community of viewers. Subscribe, like, and share. Welcome back to our conversation with Mudiwa Mundawarara, Executive Director of Island Hospice and Healthcare. Before we took the break, I did indicate, Mudiwa, that we're going to look into this beautiful partnership that you have with the King's College regarding research. Do you want to drill down in what does that involve?
Well, Trevor, an important part of palliative care, an important part of what we do is the development of palliative care solutions. And over the years, it seemed that a logical extension of what Ireland has done is to expand into research, to contribute to the body of knowledge. If you're going to advocate for something, you need to be able to demonstrate how it should be and to contribute to the body of knowledge. So over the years, Ireland has developed a very good working relationship with King's College London. We've worked on a number of research projects with them, as well as Leeds University, I might add, and obviously our own local University of Zimbabwe. Currently, we are engaged in a research project to look into cancer, which involves 3 countries. It's called a Global Health and Paliative Care research project, GAP Care. We are part of a consortium that includes King's College London, Trinity College, University of Cape Town, Makerere University in Uganda, University of Zimbabwe, and Island Hospice. In fact, the consortium will be meeting in Harare in 2 weeks' time, just to look at progress on the various different work that's being carried out in the 3 countries.
And any interesting research that stands out from these partnerships that you've been involved in terms of best practice and guidance?
Well, that's precisely what the research has been done. Recently, we concluded a project that looked into cases of multiple morbidity in older persons who suffer from various different illnesses and how to approach that. The person-centered care project is another one that we recently concluded. And as I said, this current study is looking into various aspects of cancer in various different countries, either cancer in children, rehabilitation in cancer, and just also, here in Zimbabwe, looking particularly into prostate cancer and cervical cancer and approaches to treating that.
And any opportunities for enhancing your sustainability from that?
Well, absolutely. I mentioned to you earlier on that one of the key things that we want to be able to demonstrate in Zimbabwe is the importance of palliative care, the impact on cost especially. And that's an area of research that we would like to engage the medical aids in. Recently, in one of the projects that we're doing working with older persons, we were receiving more and more anecdotal reports of a rise in dementia. And there isn't a lot of data on the prevalence of dementia. So we're currently working also on protocols for a research project to look into a prevalence study in dementia. We will need to go out and look for funding for that. So yes, there are things that arise all the time. And I think this is one of the areas that we really do need to look at in this country is locally based research, locally sourced. Much of the research that we've been involved in has come from outside. Well, it's research that's conducted here, but it's really been initiated from outside.
Yeah.
I think we need to look at a lot more sort of locally based, evidence-based research.
And in terms of the expertise, I mean, you say you train nurses. Could you just talk more about that?
We train doctors, we train nurses, we train priests and ministers, traditional healers. We train community-based health workers. All of these are people whom we've trained. During COVID, for example, we were approached by ZCC. They said, look, this COVID thing, we don't know what it is. We don't know how to deal with it. Can you come and teach us how to do that? The Jesuit order also approached us to do training in that particular regard. We regularly have courses, for example, particularly with for traditional healers, on chronic illnesses, how they work. We found, for example, that a lot of people who do come to us come very late, and before that they have been seeking help from traditional healers, taking herbs.
But it's because they don't know you exist.
Well, so what we found now is even the traditional healers are very responsive. And in many instances, we've seen now that they actually refer patients to us.
Good.
And they're starting to do it earlier so that those patients can be dealt with quite well. So, as I said, we work with people who take care of their spiritual, social, emotional needs of patients and physical needs of patients. We would like, for some time now, I've been wanting to be able to hire a spiritual director, somebody who will work with that side of things. But the constraints of funding are such that we haven't been able to do that. Because that's one area of palliative care that
it's very important.
Is very important and that we lack, especially in this part of the world where religion plays such a key and critical role in people's lives.
It would be unfair for me to let you go without talking about your other interests. You are a very public-spirited person. You've been involved with the William Sarro Trust, with the St. George's College, St. Michael's Preparatory School. Why are you drawn to this?
I don't know. I guess it's the example that my parents led. They always were people who served in various different capacities. My late father, my mother for many years worked with...
your late father, Silas Mundawarara.
That's correct.
Former deputy PM of this country. Yeah.
That's right. And my mother worked for many years with in child care. And even she's a former teacher. She stopped teaching when she got married, but subsequently she got involved in adult literacy, teaching adults to read. And so I guess that's the example that
it's the example, but what does it do to you? Where do you get the kick? Where do you get the payback?
Well, helping people is always rewarding. The various different things that you've done. I mean, in my sporting career, and right now I coach young and manage young referees, and it's tremendous.
Rugby.
Yes, it's tremendously rewarding. That's something I've been doing. I've been a referee for 35 years this year. Yeah.
Wow. Referee for 35 years, rugby. Talk to me about that responsibility. I mean, it's 35 years, that's commitment, that's passion, that's purpose. Why do you do it?
Love the game. And one of the things, again, let's break down some misconceptions. Referees are not there to be policemen or whatever. They're there to enjoy the game. And our primary responsibility as rugby referees is safety, something that people don't know. It's to ensure that the game is played safely as possible. And it's just tremendously rewarding to walk off the field after 80 minutes or 70 if it's a schools game and know that you contributed towards a great game of rugby.
And you get accused that you're supporting the other side when the other side loses.
You know, interestingly
Used to
enough,
that?
the only person who's absolutely neutral is the referee. Even the people accusing us of that, they have their biases. They're usually the coaches from that. But look, that's it's a very small part of what happens. As I said, what's great about the game is the camaraderie amongst referees, contributing towards that. And it's about management. A referee manages the players, manages the game, and laws. Rugby has laws, not rules.
I didn't know that. I am passionate, Mudiwa, about nation building, and I admire people who do the kind of work that you're doing, refereeing laws. A game has to be played by certain laws. Volunteering and doing the kind of work that you're doing. These are the building blocks of building a nation. And I absolutely admire what you're doing. Tell me, as you sit there, what's your dream for Island Hospice in the next 5 years, in the next 10 years, with all these challenges that we've spoken about? A country that's broken, health delivery service that is in a crisis, donor funding that's down. Your responsibility is to bring this organization to the future. What does that future look like?
Vibrant organization that is widely sought after by people, operating from all the major centers within the country, engaged in research, working in partnership with the private sector. One of the things that we want corporate Zimbabwe to do is to engage us a lot more. We do go out and we do, for example, wellness days, teach people about resilience, particularly, these days, mental health and challenges of mental health. Those are things that we need to work on.
That's real.
And even just on disease prevention, early detection, people going more regularly for checkups. These are the sort of things, the messages that we need to keep getting across to people. And when and if things do arise, we can provide bereavement counseling. It's often the case that an organization somebody will die of a car accident or die of a heart attack in the office, and it does traumatize staff. That's what our social workers come in and can talk to people about. So these are services that we believe we can provide. Human resources are the most important resources of organizations, and we can help very much in maintaining and upholding that very important resource within corporates.
Fantastic.
So these are areas that we could. So what we're looking to do is say, let's look at a win-win situation. We don't want to say, come just give us money. We'll say, come and engage us to add value to your organization, and at the same time,
we can provide you with certain services.
Generate revenue to do our core business of direct care. That's what I think we'd like to.
That's nation building. Mudiwa, building
sustainability.
Institutions. Absolutely. I love books, and I'm not going to let you go. Do you read?
I don't read as much as I would like to, or as I used to.
So am I putting you on the spotlight here? Shall we pass this?
No.
What books would you like to recommend? Or before you do that, as you're reflecting on that, this is a book that I really would want to recommend, particularly within the context of what we're talking about. What We Owe Each Other, which is a new social contract by Minouche Shafik. She used to be with the World Bank, the IMF, and the London School of Economics. And she's positing a new way of structuring society to deal with the challenges of, more young people in our populations, pensions, medical aid, palliative care. Who's supposed to pay for that? A great book.
I'd like to read
recommend.
that, actually.
Absolutely. What books would you want to recommend?
I think when we talked earlier on, you just talked about books that have had an impact on me.
Yeah.
Well, some years ago, there was a person who visited us from the United Kingdom, Mr. Nelson Eddy. He gave me a book called Straight and Crooked Thinking by Robert Toules. And I think that had a lot of, that impacted on me. I was about to go overseas then, and I think it really impacted on how I see how people communicate, what people do and say. And I think these days with social media and everything, the prominent position it plays, fake news, etc., I think it was a very good thing. It's something I would recommend.
That's good.
Another book, The Laws of the Game of Rugby.
I like the way you corrected me quickly. Not rules, but laws.
That's right. I mean, that's obviously a book that has had tremendous impact.
Written by?
Me. No, it's The Laws of Rugby.
Oh, right.
As framed by and written by World Rugby.
All right.
And various different people have contributed
it's a complicated
to it over the years.
game.
It is, and that is something that has affected my life, as I said, because of my passion for refereeing, and that's in my other life. That's something that I'm still very heavily involved in.
Fantastic.
I don't know, from a fiction standpoint, recently books that I've read that really impacted upon me. Khaled Hosseini, The Kite Runner. I don't know why. There was something about his books that really struck a chord. I think because they talk to the relationship between, in The Kite Runner, between a father and son, and in 1,000 Splendid Sons, a mother and a daughter. And then also just how descriptive it was of Afghanistan and what happened there. These are things that had just impacted upon me. But I'm not really a
big reader.
A big reader.
Yeah, but we're grateful for those books. Tell me, were you surprised that South Africa won the World Cup?
Not really. I think that they were working towards it. They were sort of the dark horse going in. But I think you can never write off South Africa. It was very close. Very, very close. It could have gone either way in that final, South Africa and New Zealand.
How do you see our chances of building up a side that will go that far?
In Zimbabwe? Well, the unfortunate thing is that what happened, sport reflects what's happening in the country. And a lot of talented Zimbabwean referees too, and players leave the country to go and ply their trade elsewhere because they can make money doing that. They can't do that in Zimbabwe. And then attracting them back is difficult because they can only play for one country in your life. So if they're in Scotland or in Ireland, and if they think there's a chance they could play for Scotland, they will be reluctant to come and play for Zimbabwe because that'll spoil their chance to do that. So that's...
And hence for me, Mudiwa, the importance of nation building. I mean, it's not just sports that gets knocked because of where we are as a nation. It's everything. It's important that we build this nation, which is why what you're doing is very important. So thank you so much, Mudiwa, for taking the time to come and help us understand Island Hospice. And we wish you the best in terms of turning around the organization as regarding sustainability and communicating more what this organization does, and hopefully being able to get a check from the government to support the activities that you do. So thank you so much.
Thank you. Well, thank you for the opportunity to get that message out also. Thank you.
Fantastic. Remain sitting there. Allow me to turn over now to our viewers who are at home throughout the world. We are grateful for your support. Remember, we are a weekly show. We are out every Monday on YouTube, 7 a.m. Central African time. To ensure that you don't miss out on any of these quality conversations, remember to subscribe, to like, and to share as much as possible. We view your comments under each episode as to who should come in and indeed your assessment of how the conversation went, and we appreciate that. We've gone a step further, by the way, and created a website where all our content sits, including our podcasts, for your listening pleasure. So go there and binge. Until next time, cheers to you all.